Hello, America, and welcome to the American Patriots channel. This is an episode where I know you're going to be interested in what we have to talk about because it affects each and every one of us. The topic today is health care. Let's take a look and see what the Declaration of Independence says. I think it has something to do with health care. What it says is, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness." Notice that it says we have the right to life. Now, if you don't have good health care, that could easily shorten your life. So to me, those two are related. So here's what I say. I say, it is the right of every American citizen to have life, and therefore it is the right of every American citizen to have access to quality health care. It only makes sense. However, the Declaration of Independence doesn't spell it out quite as clearly as that. I was wondering, where else can we go to get a little better idea as to the question of, is health care an actual human right or is it not? We have to look no further than the United Nations. The United Nations has a universal Declaration of Human Rights. What it says in Article 25 of that declaration is, "Everyone has the right to a standard of living adequate to the health and well-being of himself and of his family, including food, clothing, housing, and medical care." All right, so we have just established, and I think that you'll agree, that access to quality health care is a basic human right. Today, we will explore how all Americans can have this basic human right. It is our goal to come up with a plan for everyone in America to have access to quality health care that they can afford. I don't know if you've noticed, I bet you have though, that health care is really expensive. If you have insurance, you've got access to health care. If you can pay up front, you have access to health care. But if neither one applies, then you've got a problem. Sure, you can go to the emergency room, but then afterward, you're faced with a whopping bill. It's really expensive there too. Some Americans really don't have access to quality health care that they can afford. You don't want to have someone go bankrupt just because they get sick. The good news is that the government has recognized this. One example is Obamacare. Obamacare has helped 19 million people to gain access to health care coverage, health care insurance. Now, this is good. The Republican Congress came in afterward and felt that the cost of the program was too high. There again, health care is very expensive. And so they tried to make it more efficient. But every plan that they came up with resulted in fewer people being covered. So that's no good. The fact is, even though Obamacare added 19 million people to being covered under the health care program, there's still over 30 million people that are uninsured. And that's unacceptable. So the Republican plans would have only exacerbated the problem. Now, in addition to the 30 million that are uninsured, there are many that, even though they have Obamacare, and even though they may pay nothing for the premiums, have you looked at those policies recently? The co-pays and deductibles and out-of-pockets are really high on those plans. A lot of those people can't afford those, so if they get sick, they're right there again going bankrupt. They are underinsured, and there's over 46 million people that are like that. They are underinsured in our country. So what do we do about this? It just seems like it's an insurmountable project to try to get everyone fully insured and insured in such a way that they can afford the deductibles and out-of-pockets. Well, let's start by doing what we need to do. Let's get it out in the open. Let's talk about the elephant in the room. And I've already kind of mentioned it. The elephant in the room is cost. Healthcare is really expensive, and the fact is, every year the cost of healthcare goes up more than wages, and it goes up more than inflation. Now, that's not a problem if it happened just one year, but when it occurs every single year, it gets worse and worse and worse, to the point where more and more people, just like we saw, are either uninsured or underinsured. And those trends will only get worse until we address the elephant in the room, which is the cost of health care. We must reduce the cost of health care. The government can't afford it, you and I can't afford it, and our employers can't afford it either. If you're employed, you probably notice too that they're trying to cover health care as much as they can. That's one of your benefits. But at the same time, they're asking you to contribute more and more and more because the cost is just skyrocketing. All right, so let's take a little closer look then at the cost of healthcare to get a kind of an idea of how much it costs and how we compare with other countries. This bar chart shows the cost of healthcare per person in a variety of countries. Now, all of these countries are modern, industrialized, wealthy countries, including the United States, so they're similar in that way. They're similar in their makeup. In the United States, it's costing us, on average, for every man, woman, and child in the country, $11,000 per year for health care. Looking at the other countries, not a one of them pay anywhere near that much. And in fact, on average, they're paying about half that. This is the elephant in the room. Now it's out in the open. Now we know how bad it really is. This is preventing many people in our country from being able to have access to quality health care that they can afford. They're afraid to get sick because if they do, they think that they're going to go broke, they're going to go bankrupt, and they're right. This has got to be fixed. We need to look into this, find out exactly what it is that's making our health care so expensive, compare ourselves with these other countries and find out what they're doing better than us, and then fix the problem. So, let's look at it line by line and see how we compare with these other countries. All right, first up on the list for reasons for high healthcare costs in the United States is administrative costs. As a percent of the total, the United States pays about 8%, whereas the other countries are paying somewhere between 1 and 3%. All right, right there's an example where we're losing ground. We need to do better in administrative costs. Next item is prescription drugs. No surprise here. I'm sure you've heard a lot about it and unfortunately probably experienced some of it too when you go to the drugstore. On average, per person per year, we're paying $1,443 for drugs, whereas the other countries are paying $749. What about services like surgery? An appendix removal here costs on average $16,000. For them, $4,000. Knee replacement, $28,000. For them, $15,000. And heart bypass surgery, we're paying $78,000 for that, whereas they're paying about $24,000. Now, moving on, if we look at tests, and an MRI is a very common test, it's a good place to compare. We're paying on average $1,119 for our MRIs. They get one for $502. So you can see here, we're just losing ground on every single item. And significantly, in some cases, they're paying less than half of what we're paying. And then there's the problem of lack of transparency. I don't know about you, but I like to price shop and find the lowest price for the quality item that I'm looking for. And here's an example just to compare or just to demonstrate how widely prices can vary. In one particular city, there was a study done where they asked them what would it cost at urgent care facilities if I came in and needed to have blood tests to be diagnosed for COVID-19 and rule out other infections. That way we can see how much one costs versus others. The very lowest one cost $231 and the highest one cost $4,510 with an average of about $1,600. Oh boy, if you were the person who was unlucky enough to walk through the door of the facility that charges $4,500, wow, that would be bad, especially knowing you could have gotten away for the same exact test for $231. All right, and then moving on to the last example of why it costs so much, the United States has a high incident rate of hospitalizations for preventable causes. On this particular bar chart, we see that only Germany has a higher incident than we do. The United States is number 2. Now, of course, a higher incident rate of hospitalizations is going to cost more. That's obvious. But there's another aspect to this that we need to be aware of as well. This is an indication that the quality of our health care is lacking. What it indicates is that we have poorer access than the other countries to primary care, prevention, and chronic disease management. Well, there's another measure of quality of health care that you should be aware of too, and we need to take a look at that and see how we compare with these other countries. Now, you know the old adage, you get what you pay for, and you might be thinking, well, in the United States, we pay a lot, but we get a lot. The quality of our health care must be better than any in the world, right? All right, well, we saw the incident of preventable disease hospitalizations didn't seem to indicate that, but let's look at life expectancy. That's a pretty good indicator of the quality of health care too. Now, it's certainly true that health issues are not the only factor that affects life expectancy, car accidents and some other things as well, but health issues are a major contributor to life expectancy, so that's a pretty good measure at least of the quality of health care that we're receiving. And so let's look at those countries again. There again, they're all wealthy, industrialized countries. We know that they pay a whole lot less for health care than we do, and yet, look at that. We're at the bottom of the list. We have the shortest life expectancy of all the countries. It seems just backwards, really. We're paying the most for health care, and yet we have the shortest life expectancy. Even Germany, as we saw, they have the highest incident of hospitalizations due to preventable disease. They're second to the bottom, but they're better than us too. All right, so I want to dispel any fears that you might have or concerns about us working towards cutting the cost of health care. Obviously, that's what we're going to need to be working towards. But the concern that I hear all the time is, oh, if we become more like those nations there that we saw on the list, then we're going to be waiting in long lines, our health care is going to diminish, the quality is going to be poor, people are going to be coming to the United States because we have the better health care than those other countries. They're rationing health care and all kinds of things. Well, we just saw clear evidence that that is not true. Those other countries have a lower incidence of hospitalizations due to preventable disease, and they have a better life expectancy too. So rest assured, we're not out to reduce the quality of health care one iota, not a chance. We need to learn from those countries how they do more with less. All right, so we're going to solve the problem then right now. We're going to meet this challenge of reducing healthcare costs head on and figure out what we need to do. Let's take a look. All right, hold on to your seats. We're going to be comparing healthcare insurers by using a variety of measures, starting with administrative cost. We need to have low administrative costs, and we saw that other countries are paying about 1 to 3%, whereas we were paying 8%. It turns out the administrative cost related to private healthcare insurance ranges from 12 to 18%, whereas with Medicare, it's only 2%. Hey, Medicare is in line with the other countries in terms of administrative cost. Medicare gets a check in that box. That's what we need. Well, let's move on to simplified processing. Right now, if you're a healthcare provider, you have to meet all the requirements, fill out all the forms of a whole bunch of different insurance companies, including Medicare and Medicaid. That costs a lot. It's very, very inefficient. What we need in order to make that much more efficient is a single payer, a one-stop shop for our providers so that they can deal with only one insurance company. And so does private insurance meet that requirement? Nope, no they don't. How about Medicare? Oh yeah, Medicare does. One check for Medicare there too. And then bargaining power with providers. Now in some locations, there's only one provider, so they kind of have a monopoly on the whole situation. And the insurance companies just don't have much bargaining power with them. But Medicare is, as you know, that's our government. They have bargaining power, even in these monopolized regions. So there again, Medicare gets a check in that box. The next item is to include deductibles and co-pays. That way people don't just run out to the doctor every time they get the sniffles. And that helps to limit demand and limit cost. Fortunately, both private and insurance and Medicare have that feature, so both of them get a check. The next item is include no-cost preventative care. We need to try to catch things before they get worse, and that helps not only with cost, but it helps to keep a person in better health. We certainly want to have that feature, and it turns out that both private insurance and Medicare have that as well. The next one is a big important one. It's a superior track record for reducing costs. How well do these two insurance providers do when it comes to keeping a lid on price increases? Well, taking a look at these bar graphs, there's two different graphs here that are showing, the one on the left and one on the right. The one on the left shows during the years 1987 until 2014 what the cost of healthcare increases were per year on average for both Medicare and private insurance. And it turns out that Medicare experienced an increase of 5.7% on average versus private insurance during those years saw their prices go up 7%. There's a good indicator that Medicare is in a better position to hold down the cost of health care. Moving to the right, where we see the various types of services, inpatient hospital services, if we say that it costs Medicare 100%, whatever that amount happens to be, then private insurance ends up paying 89% more, almost double. What you can see there then is that Medicare costs for the same exact service, inpatient hospital service, is lower by quite a bit. It's almost half. It's just a little over half of what private insurance pays. Now, if you look at outpatient hospital service, the comparison is even more significant. Private insurance is paying almost 3 times as much for the same service as Medicare. They're paying 164% more. And then for physician services, their private insurance is paying 43% more than Medicare. It's very clear then from all of these studies that Medicare has a superior track record in holding down and reducing costs of health care. They get a big check in that box. The next item is public accountability and transparency. We want to see how they operate, what's going on, so that we can tell whether there's waste or corruption or any kind of issues to do with their costs. But unfortunately, private insurance doesn't want to let their competitors know this, so they're not transparent very much at all. And yet Medicare, obviously that's a public institution, and that is publicly accountable and transparent. So they get a check for that box too. And then finally, insurance premium based on income. Insurance premiums are expensive, sure, and yet it only makes sense to have those who are able to pay more to pay a greater amount than those who are less able. When it comes to private insurance, sorry, it's the same price for everyone. And yet with Medicare, they adjust the cost of their premium based on income. They get a check in that box as well. All right, we have just solved the problem of high-cost health care in America. The answer is Medicare for all. You saw it when we compared Medicare with private insurance. Medicare won hands down. Medicare checked every box on the list. Medicare for all would ensure that every American citizen has their basic human right met. That right is access to affordable, high-quality health care. No one would be uninsured and no one would be underinsured. No one would be afraid to get sick because they might go bankrupt. Well, you might wonder then, why haven't we done this already? It seems pretty obvious. Well, the insurance companies obviously don't want that. That would reduce their business. So instead, they've gone through that old process that we've talked about before, which is lobbying our legislators. That way, they get their way. The legislators vote for them instead of for us, the American citizens. There again, keep that in mind next time you go to the polls and vote. We want our legislators to be for us, to be working for the American citizen, not for corporations. All right, well, if we do go to Medicare for all, what does that look like then? Well, we have a snapshot of it right now because everyone who is 65 and older is already on Medicare. The quality of health care is very good and the cost is reasonable. It's not too bad. And yet, what they have to do is they have to pay a monthly premium for that coverage. It's not free, but the government pays for most of the premium. And the reason the government does that is these people have paid into their system during their entire working lives, so they're reaping the benefit of that now. If we offer Medicare to everyone under 65, then they would not get assistance from the government for those premiums, but instead they would have to handle that themselves. But there again, we'd have to use the same systems we use now. For one, if you're working, your employer pays most of the premium anyway. And then if you're not working and you have little to no income, there's government assistance, Obamacare type assistance, subsidies to help pay for the premiums in that way. The good news is that everyone would save money because the premiums for Medicare are lower than they are for private insurance. The employers would save money, the government would save money, and the employees, you and I, would save money too. And that's what we want to see. We want to see a lower cost, bring it more in line with the rest of the world, and at the same time maintain the quality of health care, just like those other countries are experiencing and taking advantage of right now. All right, well, that's all I have for today on health care in America. Next time, I'm going to be talking about a subject that is really pretty troubling. I think you're going to want to tune in and see it because I'm going to be talking about gun violence in America. We've seen too many news stories about some nut job or some criminal running around out there getting their hands on a gun and hurting or killing people. And we need to do something about it. The problem is our politicians don't seem to be very effective at it. What are they doing? For one thing, they seem to want to point to assault weapons and go after them. Well, it turns out that most of these gun violence incidents have nothing to do with an assault weapon and instead have to do with someone with a handgun. We need to address effective solutions to gun violence, not just things that look good or feel good. And that's what I'm going to talk about next time. I'm going to propose some effective solutions to gun violence in America. All right. I hope to see you next time. It's going to be very interesting, and I think that there'll be a lot of value in some of the things that I have to say. God bless America. See you next time.